Nigerian Medical Association, Sokoto State, Dr. Umar Mukhtar, an astute surgeon. The Permanent Secretary, Higher Education, Sokoto State, Dr. Meshanu. The State Coordinator of the NHIS, the Chief Team Lead for the CDC Atlanta, USA in Sokoto State, Commandant of the Nigerian Army, the Commandant of the NSCDC, our very own Mrs. Awoson, the State Commissioner of Police, ably represented, my co-keynote speaker, Professor S.O. Bello, distinguished consultants, professors, CMDs and MDs, our very distinguished colleagues of the health professions and academia, distinguished ladies and gentlemen, Assalamu alaikum warahmatullahi wabarakatuh. I say a very good morning, which is, I think is already, yes, it's still morning to all of us. The topic that I've been saddled to make a presentation on, as we can all see, is advancing healthcare in Sokoto State. Usually I speak a lot, but today I think I will not speak much. Healthcare means the organized provision of medical services, treatment and assistance to individuals to promote their physical and mental well-being and to prevent, diagnose and treat diseases, illnesses and injuries. The purpose and goals of healthcare system is to ensure the well-being of individuals and communities by promoting, maintaining and restoring health. It involves the prevention, the treatment and diagnosis of various ailments and ensuring the overall health and well-being of the populace. Efficient healthcare systems strive to provide accessible, affordable and high-quality healthcare services to their populations while addressing public health challenges, promoting preventive care and managing healthcare costs effectively. Efficient healthcare systems strive to provide such health indices that will be optimal for the nation and its communities. The components of primary health care that the healthcare system is meant to provide, organize and deliver include primary health care, preventive care, health insurance, specialized medical care, emergency care, diagnostic services, mental health services, and several others. The healthcare system refers to the organization and network of resources, institutions and professionals and services that provide medical care and promote health within a particular country or region. There are four key components of the healthcare system. Health infrastructure development and healthcare facilities is one. Others include healthcare providers, the health insurance, and health information systems. At this point, I want to take us through, if we actually want to look at advancement of healthcare in Sokoto State, we should start by identifying where is the state at the moment. If you want to advance anything, you need to know where is the state, what are the indices of the state at the moment. The data I'm presenting are from the National Demographic and Health Survey, the Nigerian Demographic and Health Survey, conducted by Nigeria, the National Population Commission, and its international allies, including the UK Development for International Aid, the CDC, the World Health Organization, UNICEF, and all that. So it is an unquestionable data with the participation of all state ministries and the Nigeria Bureau of Statistics in the country. So this is a very objective assessment. It's not about grammar. It is not about indictment. It is what statistics is telling about us. This is Sokoto State. Can we expand that a little? When you look at development, we did a secondary analysis of this. in the book that I authored on Nigeria and Africa Development Indicators Monitoring System.
The apps.
This one?
That's the pointer.
So these are the separate indicators. These are separate indicators. Can you please push it up? For Sokoto State, it's a big lot. Let me see from my own data. For this chart we are looking at, the ones that are related to health, percentage of population with improved sanitation. Improved sanitation in 2018 NDHS for Sokoto State is 43.5%. 43.5% of Sokoto State have access to improved sanitation. When you look at percentage of population with improved source of drinking water, it was 34.4%, and percentage delivery by skilled provider, whether doctors or nurses or midwives, 9.2%. When you look at percentage delivery in health facilities, 7.8%, and percentage delivery by a doctor, 0.3%. The pages on which these are in the NDHS are indicated, as you can see. For example, for improved sanitation is on page 25 of NDHS 2018. For, can you scroll up or scroll down? Up, let it go up, let the chart go up. Yes. Population with improved source of drinking water, 34.4%. Yes, move down, please. Move down, scroll down. Percentage delivery by skilled provider, 9.2. Delivery in health facility, 7.8. And percentage delivery by a doctor, 0.3. The state average for all indicators we have looked at here was 32.2. Move down, please. Move down. Now this data compares Sokoto State and other states in the federation. Percentage of the population with improved drinking water. Can you please, let's see where is Sokoto? Where is Sokoto? Let's go down. 34.4% was the least in the country with respect to this indicator. Move down, please. Move down. Percentage of population with improved sanitation. Let's see where Sokoto is. Where is Sokoto? Up. Sokoto is up there. Yes, somewhere here. For 3.5%. We can see. Yes, next, move down, please. Move down. Skill provider in the country. This is a comparison between states in the country. Where is Sokoto, please? Where is Sokoto? Where are we? Sokoto 9.2. Next to Kebbi as the last with respect to this performance. Can we move down? Delivery in health facility in the country. Where are we? Sokoto down again. The second to the last. Again, only having Kebbi only behind it. Can you go down, please? Percentage of delivery, let's see that title, delivery by doctor, right? Where are we? Sokoto again. Down there, only better than Kebbi State. What's this title? Let's see this title, please. What's this title? Birth weight average, 2.5 kilogram. That's the health of children. When you look at the health of children, where are we? Nasarawa first, Zamfara second, Kebbi third, Katsina. Where is Sokoto? We are here. We are in the green line. Here we are in the green line. Our children are not doing too badly. Yes. Thank you very much. Move down. Let's see further, please. Under 5 children that are not underweight. That's the health of children again. Where is Sokoto? Please, let's see where we are. Oh, unfortunately, again, we are only better than Kebbi. Next one, please. Next. No, we don't need this. literate women. Well, hold on, literate women, because the literacy, education of women is an important determinant of the health of children, of the families. So you can see why Sokoto is last in the country, 10.6. Last in the country. Can you move on, please? Move on, please. Women employed. You know, women employment is also important determinant of the health of families, right? So where is Sokoto? Sokoto is the first among the red line. Sokoto is the first among the red line, not as bad, right? As you know, it has been. You see, leading Jigawa, FCT, Borno, Enugu, Gombe, and all that. Next, please. Next. Under 5 children not underweight, I think we have displayed this earlier. Move on, please. Move on. Comparison. I may not want to bother us too much about this. This is the comparison of these indicators between what happened in 2013 and 2014. But let's quickly look at what has happened for Sokoto State between 2013 and 2018. What has happened? Which one do we want to look at? Let's look at improved sanitation. You can see improved sanitation. Red is 2013. 2013 Sokoto State was 46.5. The beauty of this data is that you can compare who and who were in government at the time when these things happen. Who are the leaders at those times when these things happen? And this is a way to call our leaders to accountability and for the efficiency of our system. So 2013 it was better. 2013 was better for where is that? For sanitation, 46.5. Compared to 2018, 43.5, it became worse. Go down, please. Go down. Drinking water in 2013, Sokoto State was 64.4%. But in 2018, it was 34.4%. And then, yes, literacy, women literacy, then was 2013 was 10.2 and 2018 10.6. Delivery by skill provider 5.4 in 2013, it improved to 9.2 in 2018. And we can see delivery in health facilities 4.7 then and it came to 7.8. Then move on. Percentage delivered by doctor 2% then it came down to 0.3. And the state average, you can see how it has come down. Let's go down. Yes. I think we should not bother us too much with the others. You can access this information from the paper subsequently. The more important thing is how can we move forward? I don't want to miss the point that we will not be able to move forward unless and until we begin to call our leaders to annual events where they will be called to account for how they met the ministries or the states that they have managed and how they have left it at the time that at the end of the year. Every year, if you call leaders at every level to come and give account in town hall meetings to say how did you meet your ministry, how did you meet your local government, how did you meet your state, what have you done, how have you transformed the milestones. This is very crucial for us. To be more specific, what also can we do? I want to tell us that one of the challenges of healthcare is very glaring. We don't even need to provide any data. The population of Sokoto State perhaps is in excess of 5 million or 6 as we speak. Of 100% of healthcare workers, where are they? Are they adequate in the first instance? The answer is no. Secondly, the maldistribution in the number of healthcare workers. More than 80% of healthcare workers are concentrated in Sokoto town. More than 80% of healthcare workers, whether doctors or nurses or medical laboratory scientists, whatever you want to think of, they are in Sokoto town. They are in the teaching hospital. They are at the specialist hospital. That is where the largest concentration of doctors and nurses are. This is maldistribution in terms of healthcare providers. And the health of the state and the health of the country is not determined only by the very rich people that are in the urban populations. So however well the people in urban population can be, the majority that are in the rural populations who have no access to healthcare in terms of the difficulty of road transport, in terms of the difficulty of affordability of healthcare, will bring the whole state down. Maternal mortality will continue to be very high. Whatsoever you want, infant mortality will continue to be very high. So what can we do? I was asked about the innovative thought. What can we do? Part of what we can do is this. To tell us is to say that, for example, if we can evolve a system whereby the senior registrar in the residency training program for senior registrar cadre, they will be decentralized to local government level to function in primary health care centers at that level of expertise. Imagine how we'll be able to transform the healthcare system in the state if this can happen. And something similar to this, but if we decide to do that, there will be an arrangement by which they will come to the center. There will be days for activities that they need to do in the centers. But with their level of expertise, if they are well supported, we can see how dramatically it can influence the health system in the state. I've seen something close to this in Rivers State. Specifically at the time Agmsc was governor of the state, what did he do? He built houses in local government areas for the doctors, provided them with car loans that they can pay in 4 years, gave them special salaries. They are working at local government level, not at the state ministry level, and yet with such incentives, many of them were decentralized to the primary health care center level. So federal government can be paying all these services on behalf of local government at the local government levels, because the funding at local government level is so sparse that it will not be able to cater for this. The education of their children, of all health workers, nurses, doctors, medical laboratory scientists who may be operating at the primary health care level have to be given special privilege in schools, in boarding house schools and all that, and the special allowances that they need to have for serving a rural population. Then the issue of cost and affordability, what can we do? The healthcare insurance system is still serving less than 20% of Nigerian population. Those that are mostly sick are yet not having access. The peasant farmers, people in rural communities, they are the ones that come with most risk about health. So community health insurance system has to be introduced. So we need to see how health inequalities can be improved so that there will be good access to healthcare. So I think these are very important strategies that we need to use. Disease prevention and control also need to be well improved on, and collaboration, banks, particularly with non-ethical, non-interest-based banking, and a system that the rural populations can exchange their commodities. Rural populations can exchange their commodities to make payment for health care by way of insurance will be a very good strategy. On this note, I think I want to conclude that strengthening the health system, particularly primary health care, health promotion and behavioral change and preventive care, healthcare financing, particularly at community level, are part of the most important strategies that will help us to change the dynamics of healthcare and advance the healthcare system in Sokoto State. I want to thank very much the chairman of NMA Sokoto State and his team, members of the Executive Council, and my colleagues who have the confidence in me to have been able to honor me to come and make this presentation. I'm most excited about it, particularly, let me say that why it is very fulfilling for me to have come to present this lecture is the fact that I came to Sokoto at the age of 19. And having spent about 42 years in Sokoto State, and having worked and served in Sokoto State, and for the very short time that I went out for my postgraduate study, I've always been ambassador of Sokoto State everywhere I've been. I am privileged to have married a wife from the old Sokoto State. I'm privileged to have married my female child to Sokoto town, I'm privileged to have married for my son to have married from Yago. So thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.